To our next in-service, congestive heart failure. Congestive heart failure is a chronic progressive condition, affects the pumping power of your heart muscles. While often referring to simply as heart failure, CHF specifically refers to the stages in which fluid buildups around the heart and causes it to pump inefficiently. Heart facts. The heart steadily pumps an average of 2,000 gallons of blood throughout the body each day. Has 4 chambers. The right atrium, which is the right top side of the heart, receives venous oxygen-depleted blood that has already circulated around through the body, not including the lungs, and pumps it into the right ventricle. Right ventricle is the bottom of heart on right, pumps blood to the pulmonary artery. The pulmonary artery sends the deoxygenated blood to the lungs, where it picks up oxygen in exchange for carbon dioxide. Left atrium, upper left side of heart, receives oxygenated blood from the pulmonary veins of the lungs and pumps it to the left ventricle. The left ventricle, lower side of the heart, thickest muscle mass of the heart and hardest pumping part of the heart, as it pumps blood that flows through the heart and the rest of the body other than the lungs. How the heart works. Atrium at top of heart, responsible for receiving blood from body, and ventricles at bottom of the heart, responsible for sending blood to arteries and the rest of the body. Your heart chambers fill up with blood before each beat, and the contraction pushes the blood out into the next chamber. Electrical pulses that come from anoid in the tissue of the right atrium triggers the contractions. The pulses then travel through your heart to a anoid AB node located near the center of the heart between the atria and the ventricles. These electrical impulses keep your blood flowing in proper rhythm. The heart has 4 valves, each one of the downstream end of each chamber, so that under normal conditions blood can't flow backwards and the chambers can fill with blood and pump blood forward properly. These valves can sometimes be repaired or replaced if they become damaged. Congestive heart development. Congestive heart develops when your ventricles can't pump enough blood volume to the body. Eventually, blood and other fluids can back up inside your lungs, abdomen, liver, and lower body. Types of CHF. Left-sided CHF is the common type. Left ventricles doesn't properly pump blood out to your body. Fluid builds up in the lungs and makes it difficult to breathe. 2 kinds of left-sided congestive heart failure. Systolic heart failure occurs when the left ventricle fails to contract normally. This reduces the level of force available to push blood into circulation. Without this force, the heart can't pump properly. Diastolic failure, or diastolic dysfunction, happens when the muscle in the left ventricle becomes stiff. Because it can no longer relax, the heart can't quite fill with blood between beats. Right-sided congestive heart occurs when the right ventricle has difficulty pumping blood to your lungs. Blood backs up in your blood vessels, which causes fluid retention in your lower extremities, abdomen, and other vital organs. It is possible to have left-sided and right-sided congestive heart failure at the same time. Usually the disease starts to the left side and then travels to the right side when left treated. Congestive heart failure in stage classes. Stage 1 or class 1 is you don't experience any symptoms during typical physical activity, usually managed through lifestyle changes, heart medications, and monitoring. Class 2, comfortable at rest but have activity intolerance, fatigue, short of breath, palpitations with normal physical activities, managed with lifestyle changes, heart meds, and monitoring. Class 3, noticeable limitations of physical activity, even mild exercise may cause fatigue, palpitations, or shortness of breath. Treatment more complicated. Class 4, unable to carry on any amount of physical activity without symptoms. They are present at rest. There's no cure for congestive heart failure at this stage, but there are still quality of life and palliative care options. Hypertension. When blood pressure higher than normal, heart's working harder and can lead to congestive heart failure. CAD, or coronary artery disease, higher cholesterol, fatty, sometimes blocked arteries, causing narrowing, coronary arteries, restricts your blood flow, and can lead to damage in your arteries. Valve conditions. Heart valves regulate blood flow through your heart by opening and closing to let blood in and out of the chambers. Valves that don't open and close correctly may force your ventricles to work harder to pump blood. This can be a result of heart infection or defect. Other conditions that can contribute to the development of CHF includes diabetes, thyroid disease, and obesity. Severe infections and allergic reactions may also contribute to CHF. Early signs and symptoms of CHF is fatigue, swelling in ankles, feet, and legs, weight gain, increased need to urinate, especially at night. Symptoms worsening is irregular heartbeat, cough that develops from congestive lungs, no temp, no color, no to sputum, wheezing, and short of breath indicated of pulmonary edema. Chest pain that radiates through upper body, rapid breathing, skin that appears blue, which is due to lack of oxygen in your lung, and fainting. Diagnosis is an EKG. Echo gives you the injection fraction, how much blood sends out of your heart, how well it is working. An MRI, stress test, blood test. When somebody is having worsening signs and symptoms, we'll do a BNP, heart hormone that raises with failure to see how elevated, and recheck to see if treatment is helping the BNP go down. Heart catheters to check for clogged arteries. There are many medications for treatments for CHF, the AC inhibitors, potassium, ibuprofen, vasodilators are another option if you cannot tolerate the AC inhibitors. Beta blockers can reduce blood pressure and slow rapid heart rhythm. They are the LOLs. Low pressure beta blockers should be taken with caution with the following medication, as they may cause an adverse reaction. Antiarrhythmic medication can increase cardiovascular effects, including reduced blood pressure and slowed heart rate. Antihypertensive medication may also increase the likelihood of cardiovascular effects. This is why we definitely monitor blood pressures and pulses when we're giving all patients with these meds. Diuretics will reduce your body's fluid content. CHF can cause your body to retain more fluid than it should. There are different types of diuretics, the loops, potassium sparing, thiazide diuretics. With diuretics, watch for low blood pressure when given diuretics with ACE inhibitors, anxiolytics, hypnotics, beta blockers, channel blockers, because it may cause toxicity of the liver. Surgical treatment, if medications are ineffective on their own, more invasive procedures may be required. An angioplastic procedure to open up blocked arteries is one option. Your cardiologist may also consider heart valve repair surgery to help your valves open and close properly. Often hear of ABR being done, and is arterial valve most common one to repair. What do we do as nurses? If diagnosis of CHF, watch face, hands, abdomen, legs, feet, ankles for increased edema. Notify the doctor if there is new or worsening edema so the resident can be evaluated and have med changes before CHF worsens more. Weight watch may not see the increase in abdominal or edema in extremities, but may have weight change. Requires daily weight, and make sure watching if it's a 3 pound in a day or 5 in a week, and notify doctor. Also get vital signs for the doctor so they can correlate any other changes. Watch sodium intake and fat intake. Encourage activity even in small amounts to keep them moving. As congestive heart worsens, the usually independent person will need more help. If coughing, don't always suspect pneumonia. Look for CHF. No temp, probably not respiratory, but cardiac instead. If cardiology, notify them and include vital signs, activity tolerance, oxygen sats, and any edema. A chest x-ray will show no ammonia, but may show congestion. Need changes in med, and giving the doctor all the facts of vital signs, activity tolerance, sats, edema weight will help them guide what needs to be done. They may need oxygen if not getting an appropriate amount of blood to lungs or to the rest of the body. Encouraged to still move, but do so in small increments to conserve energy and not tax the heart.